My name is Jody Dennett. I'm going to be talking about early considerations of mental illness, chapter 15. In terms of mental illness, there are a couple of words that we use pretty often. They're prominent right now. Psychopathology and abnormal behavior, those are ones we should be aware of. There are three explanations of mental illness, and in that we're going to talk about the three different types of treatments associated with those explanations. The first explanation is a biological explanation. This follows a medical model. This model assumes that all disease is caused by the malfunctioning of some aspect of the body, but mostly the brain. This can be inherited. It can be caused by tumors or toxins, disease, or stress. Some of the approaches in treatment are geared towards changing the body. So a vapor bath, Egyptians used vapor bath, massage, and herbal remedies. Hippocrates also says baths, fresh air, and proper diet, just specific things that will change the biologicalness of your body. The second explanation is a psychological approach of mental illness. This model proposes that psychological events are the causes of abnormal behavior, such as grief, anxiety, fear, disappointment, frustration, guilt, and conflict. Some of the treatments associated with that would be, how can you change your mind? So that would be a reenactment of traumatic events. They call this catharsis. It's a purging your mind of any disturbing emotions. Dream analysis or teaching new skills. This is also associated with cognitive behavior therapy, which we actually still use now today, and it's very helpful. This is to alleviate suffering. The patient should change his or her ways, and the therapist is there to help you. The third way to look at mental health is a supernatural explanation. The Greek naturalistic approach in 400 AD attributed most ailments, such as falling down, being attacked, overeating, overdrinking. It's caused by mysterious forces entering the body. So to change this, treatments would be situated in such a way that it would try to reduce or get rid of those spirits or demonic beings in your body. They used exorcisms, magic, bloodletting, and trepanation. Trepanation was back in the Stone Age. They cut an opening in the skull by chipping away at it with a sharp stone to allow the evil spirit to escape. These are some ways that the book and our notes try to describe mental illness and how we would treat it. Now, there are a few people that we should probably touch base on that are important during this time. Felipe Paracelsus, this one wasn't in our notes, but he was known for denouncing the cruel treatment of women, rejecting demonology, and keeping sorcery out of medicine. So he was a crucial guy in turning the tide a little bit. Felipe Pinel was alive from 1745 to 1826. He treated the poor in Paris. He removed the chains and changed the treatments. With him, deaths decreased and cures increased. He was also the director of the Bicentennaire and La Salpêtrière. Obviously, I'm not saying this correctly. Emil Kraepelin from 1856 to 1926. He's a psychiatrist that attempted to classify mental disorders, which is a huge step in psychology. Contributed to the Diagnostic and Statistical Manual of Mental Disorders. He started psychopharmacology also, huge deal. Leitner Whitmer from 1867 to 1959. He was known as the father of clinical psychology. He also got to coin the term clinical psychology. He was a great role model. He had the first psychological clinic and clinical training program. He created, quote unquote, the psychological clinic. Franz Anton Mesmer is known for the term mesmerizing. He was most known for his animal magnetism, which is using magnets. It was possible to redistribute the force field and restore the patient's health. He helped to deter the road away from demonology and toward a better understanding of mental illness. He also was very famous for the contagion effect. The contagion effect is the tendency for people to be more susceptible to suggestion when in a group setting. He was also known for the study on hysteria. There's a whole lot about that. It was something you should read in the book. Mental illness initially was very harshly judged. We have come a long way in the development of the treatment of the mentally ill. The mentally ill were treated poorly as lesser citizens and not even noticed or recognized as having any value. Hopefully, we'll continue to improve in our judgments and of others with psychological problems and struggles. And that was my presentation. Hope you learned a lot. Thanks.